Okay, in this video, I'm going to talk about chlamydia and chlamydophila, but we're largely going to focus on chlamydophila. Chlamydia trachomatis is the cause of the most commonly spread sexually transmitted infection in the world. So we'll cover that in your sexuality and reproduction block. We'll briefly touch on it here, but we're more focused on agents of pneumonia here. So certainly Chlamydophila pneumoniae and Chlamydophila psittaci fit into this category. But both chlamydia and chlamydophila kind of follow the same structure. So all three of these organisms, C. trachomatis, C. pneumoniae, and C. psittaci, are obligate intracellular organisms. So these are those bacteria that are parasites. So much like the rickettsia, they can't be grown in artificial media. They're going to need a host cell to grow in, and that's because just like rickettsia, they don't make enough energy. They don't make enough ATP. They're ATP vampires to survive on their own. So they steal it from a host cell. Their growth pattern is a little strange. They have these elementary bodies that are kind of like spores in that they're resistant to harsh environmental barriers, and they're somewhat dormant, and they allow the organism to survive outside of a host cell for a little while. So they're spore-like. So basically what happens is the elementary body is taken up by a susceptible cell. Then inside the cell, it reorganizes to become what's known as a reticulate body. And this reticular body is what actually is going to replicate inside the cell. So the RB is going to grow by binary fission over and over and over again, as I'm showing here. And then once it becomes, too much, it's going to create this inclusion, and eventually it's going to start moving back to an elementary body form. So as they start doing binary fission to proliferate, and then as they develop within the cell, they become elementary bodies again. And then that lyses out of the cell when it becomes too much for the cell, and then the whole cycle starts over again. If there's any reticulate body still left within the cell when it lyses, then the reticulate body will die because it can't survive outside the cell. Only the elementary bodies can. These are technically gram-negative organisms. They just have a really unusual peptidoglycan layer. So they lack N-acetylmuramic acid from the peptidoglycan, but otherwise they're a standard gram-negative organism. So that's kind of it for like their structure. So now we're going to focus more, like I said, on chlamydophila, but we're first going to touch a little bit on chlamydia. So chlamydia causes urogenital infections, obviously. It's a sexually transmitted infection. It's also the leading cause of infectious blindness in the world, and there are various serotypes that are associated with that, which we'll talk about later. But for now, what we really want to focus on is pneumonia. And actually, chlamydia can cause pneumonia, but it really only causes pneumonia in neonates. So what happens is that as chlamydia colonizes the urogenital tract, as the baby passes through the birth canal, the baby contracts chlamydia. And it's going to cause disease within the first week of the infant's life if it's not treated, if it's unknown, which it can be in women. Women are often asymptomatic, so it's sometimes difficult to test. So one of two things is going to happen. First off, it could cause neonatal inclusion conjunctivitis, which could lead to the child becoming blind. And that'll begin about 5 to 12 days after exposure. So the infant's eyelids will start to swell. And then what happens is you'll get this purulent discharge, this hyperemia, and it's this copious purulent discharge. And this discharge is incredibly infectious. There are tons of organisms in this discharge. And so what happens is the baby then inhales the discharge, and that basically leads to pneumonia. So you can't treat neonatal inclusion conjunctivitis with just a topical ointment on the eye. It won't work. It won't cover the chlamydia, and it certainly won't cover for the pneumonia. So in this case, you're going to want to use an oral therapy to take care of that. And most often, that oral therapy is initiated, and then everything is fine. Okay, but the other ones that I wanted to talk about in this video were actually the chlamydophila. So we're going to start with Chlamydophila psittaci. This is otherwise known as parrot fever or bird fever. So it's the causative agent of psittacosis. That's the other way people have referred to it in the past, psittacosis. Don't confuse it with sarcoidosis. That's a completely different disease. It's also known as ornithosis. And this is a disease with prominent systemic manifestations and respiratory symptoms. And typically we contract it from birds, but you can also get it from other animals like sheep, cows, goats, etc. And so the immunopathogenesis of this, basically the infection occurs in the respiratory tract, and then it's spread in the reticuloendothelial cells of the liver and spleen, and they'll multiply there, causing kind of a focal necrosis. And then the lung and other organs are then seeded as a result of hematogenous spread, which basically means by the bloodstream. It's going to spread throughout the body. And that's going to give you a really strong lymphocytic inflammatory response. And this is what is going to cause damage. So you're going to get edema and thickening of the alveolar wall in the lungs. You're going to get infiltration of the macrophages. You're going to get necrosis, occasionally hemorrhage. And the other thing is that you can get mucus plugs here, kind of like we talked about with asthma. So you can get this mucus plugging in the bronchioles, and that can lead to cyanosis and obviously difficulty breathing. So typically it is an atypical pneumonia. It's generally self-limited, but you're obviously going to feel pretty rotten for the majority of the time. So how do we get it? It's acquired by inhalation of dried bird excrement, so pet store owners, turkey farmers, and of course, pirates. So that's Chlamydophila psittaci. So on to Chlamydophila pneumoniae. This is a human pathogen, and it's another cause of pneumonia that we'll talk about in a little bit of detail here. It normally causes a sinusitis or a pharyngitis, bronchitis, kind of an atypical pneumonia. That's kind of an important distinction here. This isn't, the kind of pneumonia where you're going to be flat on your back, waiting to go to the hospital or see a doctor because you're so sick. It's something you can live with. So you're going to have this persistent cough, malaise. Most patients don't require hospitalization. For those who have a more severe respiratory tract infection, it can involve a single lobe of the lung, but sometimes you can have a little more severe. And it's believed to be transmitted person to person through aerosols, much like a lot of the other pneumonia organisms that we've talked about. And you can treat it. Doxycycline is an option, and levofloxacin, which we've talked about a bit, is a good treatment, obviously, for M. pneumoniae and strep pneumoniae. So that's a pretty good drug when you're considering a pneumonia diagnosis. And that is all I have on Chlamydophila for now. We will talk about chlamydia in much more detail later in your curriculum.